feeling and breathing better, the power of lifestyle changes in treatment and prevention of congestive heart failure. This is actually an extremely important topic. Unfortunately, I'm thinking at this stage in life for many of us, because we've gotten so good at treating heart attacks and strokes and bypass surgery and good medical therapy, we're going to become older and frail, and we're going to develop congestive heart failure. And so there are really important steps that you can take now before you have it, or if you have it, to be better. And so I'm really pleased that Monica and her team are going to be talking about this. So let's see what we have to talk about today. Take it away, Monica.
Thank you, Dr. Kernew. We're all very excited to be here to talk about this. So to begin, I'd just like to preface that we do have a congestive heart failure series up on Dr. Kernew's YouTube page. So we've talked about a lot of different aspects of this topic. So if you go through the series, our part 1 was about what is congestive heart failure. So if you're wondering what it is, what is the diagnosis of it, you can go back and have a look at that video. So we talk about the symptoms as well, what type of symptoms might be associated with congestive heart failure. The second part of the series were the different types of heart failure. So there are different types, and depending on that, you work alongside your doctor to figure out the best treatment plan depending on what your diagnosis is.
So we're just going to pause here for a sec. We all understand when the heart muscle is weak, but a lot of us have an understanding what a stiff heart is. And there's a hormone called brain natriuretic polypeptide, or pronatriuretic polypeptide, that we're using more and more. And on your far right, you should look at this. This is actually the most common form of congestive heart failure. And you can look at H2 stands for basically being heavy. If you have a body mass index that's over 30, number 2, high blood pressure on 2 blood pressure pills, you already have 3 points. If you go down to being elderly, that's over the age of 60, that gives you 4 points. And if you see that 4 points gives you a probability that you will have heart failure 70% of the time if you're short of breath. I'll repeat that. By just being heavy, a body mass index over the age of 30, having high blood pressure requiring 2 medications, and being over the age of 60 years of age, you probably have congestive heart failure, or you're developing congestive heart failure if you're not careful. So one of my pleas to you is know your blood pressure, have a machine, and no longer say I'm measuring at Shoppers Drug Mart, I'm measuring at the pharmacy, at the office. You need to be ownership of your health, and having a blood pressure machine should be part of what you have in your health. Starting with your scale, looking at these sorts of things. I know how to make you make aging better. So it's really important to think about what to do in the circumstances, and then we can talk about the other stuff too as well. But it's really important for all of us, and this is instrumental. If you have a body mass index over 23, your risk of being in the ICU goes up with COVID. I'll repeat that. To be in the ICU with COVID, most people have a body mass index over 23. Normal is between 20 and 25. So I've taken the time and we put the effort to get my body mass index and yours under 25. It's no longer acceptable in my mind to not try to get your weight down anymore. We gotta get back. We have to have fun doing this. Let's do it. Next slide, please.
And then the last part of the series, we talked about treatment and management of congestive heart failure. And that's very important. So as Dr. Kernew just mentioned, we need to be better about all of our health. So we did talk more about what type of treatment options are available, but the management is also a very key part of just having an overall healthier lifestyle. So that's kind of what we really want to hone in on today and pinpoint is how can we really manage and how can we manage congestive heart failure from the health aspect. So focusing in on exercise, diet, how to track your health. So tracking and measuring is a very important component to make sure that you're on track. Because if we're not measuring, then it's very easy for us to just kind of like lose our path and end up winding down the same road. So that's what we're excited to talk about today. So for today's agenda, we're going to go over the key lifestyle changes that should be made, especially when dealing with congestive heart failure. We have a quick treat for all of us tonight. We're going to do a live exercise together that is friendly for all ages. So we're going to have easier versions and then harder versions. So it'll help us get up and stretch while we're even talking about it. And then we're going to talk about what should we do, what should we track for our health, what's important to track, tools to help track those health components, and then finally we're going to wrap up with prevention and management. So it's always better to try to prevent something before it gets worse. So we're going to talk about how can we do that and what is possible, what are the possible things that we can do for that. So just before we jump right into it, there is a Google form for you to fill out. So if you want to take a quick picture of the slide or write down this website, and it'll take you to the Google form. And there you can fill it out as we go through the presentation. Or if you're watching this later on, you can access this from the description of the YouTube video and fill it out as you watch through the presentation as well.
Hey guys, I'm computer stupid, so how do I get this form now? Can I get it right now?
You can get it right now if you would like to write it out. Stuart, is there a faster way maybe?
Yeah, there is a faster way. If you check the description of our videos, it'll be the hyperlink. You just one click and you go right to the form. So right underneath this video on YouTube, we have about 17 people on YouTube right now. If you just look right under the video, you'll see a blue bar that looks just like this. You click it once and you'll go right to the form.
So you just print it off, and you can email it back to us if you want to at drkernew232@gmail.com. It's a feedback form for us, and more importantly, it's a feedback form for you if you have congestive heart failure, or you think you might have it, or how to prevent it. So kind of important to think about this. And you can do this today, tomorrow, and if you're not sure, we can help you figure that out too as well, because many times I'm not sure a lot of things, and so just ask.
And the great thing about this as well is you can actually just press the submit button at the bottom of the form, and it's all digital, so we get the results right away. So you don't have to email or anything like that.
Holy cow, new things to learn. See, all this technology that we're learning about. Even older people like me in their early 60s can learn new things. Thank you so much, guys. They're just laughing at me. That's good. Keep laughing at me.
We're already learning, and we're only a few minutes in, so that's great. Okay, so if that's all worked out with the links, let's jump right into it. So to begin, here is a healthy lung x-ray. So it's a regular set of lungs. And we have two x-rays on this next slide here. So one of them is a COVID-19 patient, and one of them is a congestive heart failure patient. So can you kind of tell the difference between which one might be which? Or do they look super similar? We'll just give you... Go ahead, doctor.
Well, people are thinking about this. So the middle part is the heart that we see, and the blacker parts are the lungs. Now, if you go back to that initial slide beforehand, you can see that the lights are much darker. You can see, and so there's good aeration in there. Black is air. Next slide, please. The heart is small. And this one, the heart is bigger, and both these things. And the lungs are a mess. On the far left, it's a big mess. On the small right is a small mess. Now, to be honest with you, is pneumonia, congestive heart failure, and COVID can look exactly the same. And the only way you know this is the first one on COVID-19 on the left, because the name says it is, but you need a clinical presentation. So this lung on the left side is an individual of a 34-year-old individual who's actually brand new diabetic, and came into the hospital and is fighting for their life with COVID-19. So 34 years, never know they're diabetic. They had high blood pressure, they had diabetes, they weren't properly treated, had a body mass index of about 40. I also have a patient that has a similar chest x-ray who's 34 with COVID, who's skinny. And so, you know, it's like, so COVID certainly likes to hurt older people first, people with risk factors, as you know. But congestive heart failure and COVID can look the same on chest X-ray, so it's just one of the tools that we use. Next slide, please.
Okay, so we're going to get into our first topic of lifestyle changes and healthy living, kind of the broader view of it. So why do we need to make lifestyle changes? You know, everyone says exercise is good for you, and we've heard, yeah, it can improve your health, but we're going to get down to the actual details of it, because if we can understand why it's good, then it'll help us know why are we doing what we're doing. So following recommendations about diet, exercise, and other habits can actually help alleviate the heart failure symptoms. It can slow down the disease's progression, and it will improve your everyday life. So these are still pretty broad statements. They sound great, but how does that happen, or why is that good? So it is possible, scientifically researched, that people with mild to moderate heart failure can lead normal lives if they are following these lifestyle changes. You don't have to be in pain every day and really struggling to breathe even. Shortness of breath is a big thing. These things can be alleviated with what we're going to discuss today. So before we keep going, we want to think about how can we rank ourselves or find out what is our current health. So there's a few surveys and questionnaires that have been put together by the medical community, and they've been researched. And we can use these to see where's our starting point, because as we said, measuring is very important. So here's the first questionnaire. It's called the Clinical Frailty Scale that we want to share with you. So this is a scale from 1 to 9 about how frail your health is. So 1 is you're very fit, you're robust, active, energetic, you don't have diseases, you exercise regularly, you're among the fittest of the age. And then it ranks all the way down to 9, where you're someone's terminally ill, and they have a life expectancy of less than 6 months. So you can see each stage has a ranking, and you're going to find this as well on your Google form if you've opened it up. You'll see this, and you'll be able to read the photo of the different things. So where do we fall on the scale? Where is my health on this scale?
So everybody take an honest look at themselves. Are you a 1? Are you a 7? Are you a 4? Are you a 9? Some days I feel like a 9. Some days I feel like I was an 8. Some days I feel like I'm a super 1. But really think about, how do you spend most of your life? And I think one of the most important things, once you lose the ability to walk well, you're in trouble. Now, good thing we have devices from canes for walkers can extend that, and that's very important. I have arthritis, doctor. I'll exercise tomorrow. There may not be a good tomorrow for many of us. So how do we move ourselves off this scale and make ourselves healthier? So I think those pictures are worth 1,000 words. And you can just take the time and look at that and rank yourself and how to make yourself stronger.
So this is one good tool to start off with. The next tool I want to talk about is it's a health-related quality of life assessment. So it's also called the Kansas City Cardiomyopathy Questionnaire. And this is a very useful survey as well. So the way that this questionnaire works is there's 12 questions, and the answers on the questions are scaled on a 5 to 7 point scale, depending on how you answer it. And then those scores are converted into 4 continuous scores that will give you a final score between 0 and 100. So the lower the score, the worse off the quality of life is. And this questionnaire asks about 4 main categories: physical limitations, symptom frequency, general quality of life, and social limitations. And you can actually use this questionnaire. It can ask you about different things. So something we're going to talk about is the 6-minute walk test, which is a really great tracking tool to use for health. So the questionnaire also has a question about that, and you can rank yourself. What would you rank yourself today versus maybe in a month from now after you get moving again? So this questionnaire is also scientifically backed. There was a global congestive heart failure study that it was a global study with 23,000 adult patients with heart failure over 40 countries, and they were followed for 5 years. And this study was able to show that the poor score on that Kansas City questionnaire is actually a strong predictor of mortality and hospitalization. So when we're talking about these questionnaires, we're not just kind of saying it, oh, this is a fun thing to fill out. It's actually a good predictor of where you might end up if you don't start making the changes from now. So it's good that we're talking about it all together. So the reality is with heart failure is that 1 in 5 people are at risk of developing heart failure at 65 years of age. So that's it's not that far off. It's something that we need to really think about, whether we're at that age or younger or older. It's good to know these numbers and statistics so that we can really work on becoming like a healthier version of ourselves. And 50% of people diagnosed with heart failure die within 5 years. So it's a pretty sad statistic, but there is hope and there's things that we can do about it. It's not the last sentence of it.
So we showed you that questionnaire about diastolic heart failure. And basically, I get a point because I'm almost 62. I get no points because I don't have high blood pressure, and I get no points because I have a body mass index of 25. And so you know, these are so important. So you know, and also you have to control these things. And remember, it's no fun to have congestive heart failure. Well, you can make your quality better. And once you make the diagnosis, once it's firmly established, the 5-year mortality is 50%. And so there's no cure for it. We can certainly help it and treat it. There's so much we can do about it. But really important, much better to prevent it from happening in the first place. Know your blood pressure, know your weight, and get it down.
So this is a quote that we're going to circle back to again at the end of the presentation, but I want you to keep this in the back of your mind while we're talking about these things. So knowing is not enough. So today we're going to sit down and we're going to learn and know, but we must apply. Willing is not enough. We must do. So I want to do something, but what matters more is that I actually do it, not that I'm sitting here saying I want to do it. So keep this in the back of your mind while we're going through these. Think about how can I start applying these little tidbits in my life, or what small changes can I make while we're talking here together, and ask questions if you have questions. Fill in the survey as we go. Like make those things that we're learning into actions so that they can be fruitful and helpful.
And look, I'm always hungry. I always will be hungry. I'll always do things wrong. I'll keep working better. I have to thank so many people from our weight loss club. I'm looking forward to this Sunday cooking with Didi and her magic and things of that nature. I really enjoy Mira and Devanshi and how they helped me lose 20 pounds, and Jerry and his team about make me realize that what's in my brain and how to take my negative thoughts and make them more positive. So I'm really enjoying this journey. I'm not here to preach. I'm just here to help. And basically is don't give up, try differently, and enjoy the process. You can do it.
Yes, and it's extra fun when you do it with people. So that's Dr. Kearney has created a great community here for that. So as we mentioned earlier, the goal for heart failure management is to improve the survival and reduce the disease progression, help out with the symptoms, and improve the functional capacity and overall quality of life. So, when we say that exercise is good for you, why is it specifically good? Well, it has lots of benefits. Exercising regularly will reduce heart disease risk factors, and it reduces the chance of having future heart problems. It helps strengthen the heart muscle and the cardiovascular system when you exercise. It improves circulation and helps the body use oxygen better. So when you have better oxygen and circulation, that in turn leads to increased energy levels, because the way that we make energy with our body, we need that oxygen to help. So when you have more energy, you're able to do more activities without becoming as tired or as short of breath necessarily. And then it also helps improve your muscle tone and strength, and it improves balance and joint flexibility. Especially as we get older, our bones can become more fragile. So exercising can also help reduce the pain associated with that. So as you can see, exercise works on a multiple levels of our body to actually help improve quality of life. And again, it's been scientifically researched and scientifically backed. So 26 million people worldwide are living with heart failure, and that's a lot of people. So this is not a battle to fight alone. There's lots of resources out there. So there was a study that was conducted on aging hearts, and it showed that exercise was actually able to improve, resulted in 18% improvement in maximum oxygen intake during the exercise, and more than 25% improvement in the compliance or elasticity of the left ventricular muscle of the heart. So it really helps the heart muscle strengthen, although they may be battling heart failure. There was another study that was conducted about exercise and heart failure, and they summarized 3 things which are key. The first one is exercise is a primary tool for prevention in heart failure patients. So it's very important to prevent heart failure to begin with. It's also a therapy. So we talked about different treatments for heart failure. Exercise is actually a therapy for heart failure, so it can be a type of treatment. And finally, it is a strong prognostic parameter for heart failure patients. So you can see here, like, exercise is scientifically backed. We can see it's very helpful for the body. So how can we actually make this part of our lifestyle rather than just a chore? We'll get into that a bit later in the segment. So the second component to this for lifestyle changes is eating. We can go out, do a 6-minute walk test, but then we're spending the rest of the 23 hours and 54 minutes of the day maybe snacking or doing something else, right? So eating is a massive component for lifestyle. Healthy eating is very important. So we have a few tips here that we've gone over before, but it's important to go over again and keep reminding ourselves. So plenty of vegetables and fruits should fill your plate. Instead of reaching for a bag of chips, maybe swap it in for a fruit or a vegetable at least once in the day or twice in the day, and slowly you'll start getting more used to just grabbing a healthier snack. Choose more proteins that come from plants. That's also important because it has different health benefits associated with it. Avoid the processed foods that are usually high in sodium, fats, cholesterol. So it would be better to cook at home, actually. I see Dr. Kernew found an apple. Great choice, Dr. Kernew. And also mindful eating is a big thing. So there's actually a lot of science behind that, and we've talked about it also on Dr. Kernew's YouTube channel. But to summarize it, mindful eating essentially means when you're sitting down to eat a meal, are you sitting with others to eat, or are you eating alone watching TV? And it actually affects the way that the nutrients are absorbed in your body. So it's good to be mindful of when are we eating, what times of the day are we eating, how are we eating the food. All of these will affect your overall processing of nutrients. And then, of course, we have Canada's food guide to reference as well. Water is also very important. Instead of grabbing that Diet Coke, swap it in for a bottle of water. And then, awesome, we've got a great setup here today. Stuart has his water. I've got my water beside me too, Dr. Kernew. So we're all set. Let's avoid the sugars and in the drinks as much as possible. So plant-based eating, so we said try to choose proteins that are more plant-based. So it's not just beneficial for the environment, it's also beneficial for us. So how to go plant-based? Essentially, there is this great chart here that you can reference. So these are all plant-based proteins. So lots of types of beans or peas, chia seeds, hazelnuts, lots of seeds, black beans, almond butter. Almond butter is quite delicious. on a banana if you ever want to have that combination. Trade that in for peanut butter instead. Almond butter is really good. So it's essentially legumes, nuts and seeds, quinoa, oatmeal, tofu. These are all plant-based proteins. So protein is important for the diet, but try to choose more plant-based ones. And essentially, we're saying all this because it comes down to calorie restriction. So in order to lose weight, you need to be eating less calories than you're burning. So if I'm sedentary all day, I'm not burning as many calories because I'm just sitting in one spot. So if I'm eating a lot more food than I am moving, it's not gonna balance out. So my net calorie intake is gonna be too much, and then I'll start gaining weight, which COVID has unfortunately contributed to that a little bit. But now the sun's out, so I'm ready to get outside and walking again. And hopefully they'll start opening some tennis courts and go play tennis. And make sure that my calories are not, what I'm eating is not as much as what I'm burning off, or, yeah. So to kind of wrap up the diet component, Dr. Kernew, as he mentioned, Aditi runs the cooking club, and she cooks on Sunday evenings, I believe, and it has a lot of benefits. So be sure to check out some of the videos on YouTube about healthy eating, or how to make easy, fast, healthy meals. It doesn't have to be as complicated and hard as it can sound.
So Didi made great contributions. Steffi and Zoya and others have really brought this to a very high level. Dr. Ganguly, our vegan friend, comes on there, and Chad comes in. Just so many people that have really taught me so many different things. And I learned something called kombucha. Did I even pronounce it right, Didi? How do I pronounce that thing?
I think you pronounced it right. It's kombucha, yeah.
So it's fermented tea. It has the fuzziness of pop. Actually, my wife made me a batch. So she made like 12 liters, I think she made. And I think it had like a cup of sugar and all this. We put all sorts of berries, and we put different teas and things of that nature as well. And not bad at all. And so I dilute it with water. What are we making this Sunday, Didi?
So this Sunday is curry with a little bit of coconut. It does have some saturated fats. I'm going to reduce the amount, and mangoes in it as well.
So if you're interested, we do cooking once a month. Come join us for supper from 4 to 6. And if you're interested, just let us know and just send us an email. We'll include you. Zoya's taught me how to eat well for less, and how to cook better and things of that nature. And same thing with Steffi as well, with her great recipes and great cooking skills. So I'm a messy cook. I learned to eat better, and it's fun. Yes,
it is fun. Yeah, and that Sunday night dinner sounds quite delicious, actually. Okay, so that's pretty much it for the diet portion. But just to zoom out for a second, heart failure is a result of many things. So to get a BMI greater than 30 or even greater than 25, it takes a buildup of a lot of constant decisions that are not the greatest or healthiest choices. So over time, these constant little choices that are not the most healthy, they add up, and they end up becoming this big glacier. And then the tip of the glacier is hospitalizations, severe shortness of breath, a very poor heart muscle that's just not, it's really struggling to pump. So it's good to know that swapping in choices for other choices, those will also add up, and those will help in the long term as well. So it's good to just zoom out and have that big picture in mind of why these little choices will matter in the long term. Okay, so now I'll throw it over to Aditi.
Okay, so now we're into the exercise portion. So before we get to the actual live exercise, I'm going to briefly recap some of the benefits of exercise. So Monica already touched on this. So as you can see, regular exercise has a whole bunch of different benefits, and they all kind of tie in together to make you a healthier person. So improving circulation, just strengthening your heart and your cardiovascular system, also helps improve balance and joint flexibility, your muscle tone and strength, your energy levels. It helps decrease other risk factors you might have. And just to recap of the slide from the last congestive heart failure presentation we had. So the Canadian Physical Activity Guidelines recommends accumulating around 150 minutes of moderate to vigorous intensity aerobic physical activity every week, and that can be in bouts of 10 minutes or more. Also has a lot of benefits. Some examples of those things are brisk walking, cycling, swimming, hiking, and it's also recommended that you try and incorporate something that works on your muscles and bone strength as well at least 2 days a week. So you're getting that overall exercise that's going to benefit your health the most. So just a few reminders before we start. Exercise is great in that it's helping your body feel better and it's kind of pushing your body, but you don't want to go too far. So start slowly and gradually and increase your pace and intensity over time. If you ever feel very short of breath, please slow down. So a good hallmark is to see how well you can hold a conversation while you're doing the exercise. If you find that you can hold a conversation, maybe having a little bit of difficulty, that's okay. If you feel excessively short of breath, like you're not able to say anything as you're doing the activity, it might be a good idea to try and slow down and see what you're able to tolerate better. So remember to warm up and cool down. That's really important, easing you into the activity and also bringing you out of it. You never want to stop an exercise suddenly or an exercise routine suddenly. That's kind of jarring to your system. So you want to ease your way in and ease your way out. If you feel any chest pain or discomfort in your chest during exercise, slow down, take a break, rest. Simplify and modify any exercises as you need them. And if you feel sharp pain during any exercise that goes away when you stop doing it, don't continue with it, try to modify it. So for example, if you're doing a stretch and you get like a shooting pain that immediately goes away when you're not doing the stretch, it might be a good idea to try and avoid that because your body's kind of signaling that there might be something wrong. So try like a modified or an easier version. And if you feel lightheaded or dizzy at any point, again, please stop and take a rest. Okay, so we're gonna get moving. You can do all of these exercises either seated or standing. It's up to your level of comfort and what you're able to do. So we're gonna do a little bit of a warm-up with some breathing, some neck and shoulder rolls, and then a little bit of marching, which you can do seated or standing. And then we'll do some light, like static stretches, some movement and dynamic stretches, and then a little bit of a cool down. So we're going to start off by breathing. Breathing is the foundation of anything you're going to do with exercise. If you don't know how to breathe properly while you exercise, it'll be harder for you. So we're going to do just 45 seconds of proper, like active breath to kind of get our bodies into the zone for that. So you want to either be seated or standing. Posture is really important. So seated nice and tall as though something is pulling you up. If there's a string connected to the ceiling that's pulling you up. Keep your core muscles strong. Keep your shoulders back. And then as you breathe in, you want your belly to expand, not your chest to move or anything like that. So you can just take a nice deep breath in, put your hand on your stomach if you would like and feel it swell. And then as you exhale, you want to contract your belly. Imagine that your belly button or your navel is going towards your spine. And just do that for 45 seconds till you get the hang of it and you get comfortable with it.
Does it matter if you breathe through your nose or mouth?
It does not. If you're going to be exhaling during activity, you'll naturally breathe through your mouth as you'll get tired, but it does not matter how you're breathing in through your nose or out through your mouth. Okay, so that was 45 seconds of just focusing on breathing, so keep that in mind as we move through. And we can move to the second set. So as you're breathing, we can start off with neck rolls. That's just to kind of loosen up the muscles that are kind of tight as we sit the entire day. So roll your neck slowly in one direction and do that about 6 times and then roll it in the other direction. And if it feels uncomfortable, you can kind of take it a little more slowly and potentially stop if you need to.
Is it making anyone else dizzy?
It's making me a little bit dizzy, so I find that if I just slow down or even just close your eyes, that kind of helps me. So if that happens to anyone, maybe try closing your eyes or doing less repetitions. It's just to kind of get your neck loose, because our neck tends to be in like such a static position most of the day. It kind of needs that relaxation and movement. Okay, so the next thing we're going to move on to is shoulder rolls. Sorry, go back to the slide 1 second. Yeah, so this is really important for posture. If you're sitting, you spend most of the day kind of hunched forward, so this is going to help bring you back and kind of alleviate pain in your back. So you basically want to bring your shoulders up towards your ears and then draw it back as though you're putting your shoulder blades in your back pocket. And just do that 6 to 8 times or until you feel a little more comfortable. Okay, and once everyone's done, we can move on to marching. So this is just getting us a little bit active before we go into more stretches. So either seated or standing, we're just going to march on the spot for 30 seconds. So I'm going to do it standing, but if you're going to do it seated, you can choose to move your arms if you would like, and basically you're just lifting your knees up and down and alternating them. Okay, and we're just going to go for 30 seconds on the spot. And if marching is uncomfortable, so you're not able to lift your knees super high, you can just walk on the spot. Okay, so that was 30 seconds, and that's our warm-up, so just getting our body warm to do a little more activity. So now we'll move into some of the light stretches. The first one is a torso stretch. If you're not very confident in your posture or your balance, I recommend you do this seated. Basically, you're going to put your hands behind your head. You're going to stand or sit tall with your feet flat on the ground, approximately shoulder distance apart. And you're going to bend your body to one side. Your face should be facing forward. Hold it for 5 seconds, return to the original position, then go to the opposite side. And you can do this around 6 to 8 times per side. Okay, and next up is our torso twist. Again, if you're not confident in your posture or your ability to hold this position while standing, please do it seated. So again, same position with our feet shoulder width apart, standing nice and tall. Place your hands behind your head. You're going to twist to one side, hold it for 10 to 30 seconds. Come back to the starting position and then do the other side, and do that 6 times per side. And the next exercise we have is a neck stretch. So again, either sitting or standing, slowly turn your head to one direction. Hold it for 10 to 30 seconds, whatever feels comfortable for you. Then return to the starting position and do the other side. Okay, and next up we have a calf stretch. So this is a stretch for our legs. Basically, you're going to need to find a wall near you. And what you do, I'll demonstrate not on a wall, but you place your hands up against a wall. You have one leg that's behind you, slight bend in it, another leg that's in front of you, slight bend in it. And you kind of just move forward through the bent leg that's in front of you, and you should feel a stretch in the back of your calf. For this one, again, you'll hold for like 10 to 30 seconds and then switch sides, alternating your legs. For this one, if you're not confident in the calf stretch, you can just sit in your chair and kind of raise your heels and alternate that. If you're feeling more confident, a challenge for you is to try and get the knee of the leg that's bent in front of you as close to the wall as possible. Okay, and next up we're going to get into some more dynamic stuff. So we'll start by marching on the spot for 30 seconds again. So you can just go and slide back. So either seated or standing, we'll just go for 30 seconds. Okay, and that was 30 seconds. So the next exercise we're going to do is a little bit of like dynamic movement. This is good for kind of stabilizing your hips for walking. So advanced version is kind of get a wall or a chair. You're going to put one leg out in front of you, swing it to one side, swing it to the other side. If you're not comfortable doing that, just go to a wall or grab a chair. Just put your leg on one side, bring it back. So don't swing it if you don't have that much mobility. After you've warmed up one leg, you can switch to the other leg. Okay, and once your hips are warm, our next exercise is again some more marching. So on we go for another 30 seconds. Okay, so the next little bit is kind of the challenge of the movement. So we're going to do marching again, but if you're able to, try and increase the speed of your marching. And for an added challenge, you can add some arm circles in. So another 30 seconds of marching, arm circles in if you're able to. And make sure you do arm circles in both directions, so switch halfway through. Okay, and that was our last 30 seconds of the dynamic stage. And now we're going to move to cool down. So slowly walk on the spot for 30 seconds. This is just so that you're not immediately sitting down. So just slow to a nice walk. Oh, I was muted. Try and hold your shoulder stretch for 30 seconds. And moving on to your overhead triceps stretch. So bend your elbow and try and bring it down as far as you can. And finally, onto a leg stretch. So this one, you're just going to spread your legs as far as you can on your chair till you feel a stretch in your inner thigh. And if you are okay to do it, try and touch the floor. That'll give you a nice stretch in your back. If you have issues with dizziness and things like that, this might not be something you try. Just stick with the inner thigh stretch. Okay, and finally, if you have it within your flexibility range, you can also bring your legs together and do a toe touch. Again, if you have issues with postural dizziness, don't try this. Just stick with stretching in the chair. Don't bend down. And that was it for a live exercise. That was around 10 to 12 minutes. I got all of that from the American Heart Association and the British Heart Foundation. The British Heart Foundation actually has 50-minute length videos of seated or standing programs. So if you're looking for something that's longer, highly recommend checking them out on YouTube. And now some general rules of exercise for you to follow. So work towards 20 to 30 minutes of activity almost every day. Again, it can be in those bouts of 10 minutes. And you want to try to build up to 30 minutes of continuous activity. You want to avoid holding your breath while doing any exercises, especially resistance training. And always warm up and cool down. So you're easing yourself in and easing yourself out. Lastly, you want to incorporate some stretching into your routine. So you saw with that live exercise, we started with stretching and we ended with stretching. It's great for your flexibility and mobility. Also helps release tension that you might have built up in your muscles and joints throughout the day. Don't exercise outside if it's super hot or humid or cold. Extreme temperatures can kind of drain your energy, make you sweat more, things like that. And make sure you're adequately hydrated. So take a moment, grab your water, drink some water. And it's also important to remember to exercise when you have the most energy. So for a lot of people, that might be in the morning or earlier during the day. If you happen to be someone who likes exercising in the evening, then do that. Do what works best for you. And then if you're exercising outside, again, limit the distance you go. So if you're thinking of going outside for a walk, maybe don't go too far. Just do a couple of laps of a loop. That way you make sure you don't get too far from home and aren't too tired to come back. And a good benchmark for exercise, as I mentioned, is if you're able to hold conversation. If you have slight difficulty doing it and are kind of like finding yourself a little bit out of breath, that's okay. It means it's about moderate intensity. If you're extremely out of breath, you might want to slow down until you're able to tolerate that form of exercise better. And if you ever feel chest pain or discomfort, very short of breath, lightheaded or dizzy, unwell, slow down and take a rest, and never suddenly stop. You always want to slow down and then stop. So if you're doing something like you're marching on the spot, you don't want to all of a sudden just come and sit down. You want to slow down and then sit down and then rest. Okay, and so a couple of exercises to try, lots of stretching, light aerobic activity like walking, swimming, cycling, light weights or resistance. So limit the amount of repetitions and sets when you're using light weights or resistance, just because with resistance activity, sometimes you have the tendency to make it more high intensity, to hold your breath, which are things you want to avoid. And the 6-minute walk test, which we're going to talk about in the upcoming slides, is a great benchmark for measuring progress. And you can also try yoga or Tai Chi. And if you don't feel super confident on your feet, there are plenty of chair versions that are available on YouTube, so I recommend checking those out. Things to avoid is high-intensity resistance training, static or isometric exercises. So these are things that encourage you to hold your breath, things like push-ups or planks. And any exercise that makes you feel unwell, dizzy, short of breath, or causes any pain or discomfort. So onto the 6-minute walk test. This is basically the distance you're able to walk over 6 minutes. It measures your functional capacity and response to treatments. So it's a great predictor for mortality from heart failure. So a 6-minute walking distance of less than 300 meters predicts poorer outcomes. So basically what you do is set a timer for 6 minutes and you start walking. If you feel tired, you can stop, but the timer shouldn't stop. And then you measure how much distance you walked in those 6 minutes. And you can do this at different points to kind of see how your progress is going, and how you're responding to treatments, and what's your kind of outcome that we can predict from the results of your 6-minute walk test.
So this is something that I encourage everybody to do on a regular basis. So this is actually something that Monica was talking about congestive heart failure. The Kansas City questionnaire predicts mortality. The 6-minute walk test predicts mortality quite well, and it's actually probably in the latest survey was done by something you said that you showed. It was the second best predictor of mortality. The first predictor was the Kansas City questionnaire, and this was a very good thing to think about. So I'm going to encourage everybody once every couple of weeks to walk 6 minutes and see how far you can go. How many steps? How many distance? I was just looking at my excuse me, at my my Google notes, and I remember doing this in January the 11th. Excuse me. I did the Chinook step when you're allowed to do that, so I went up all the way down, back, and went up 114 steps the second time around. So, so challenge yourself, but for prognostic perspective, see how far you can walk in six minutes. Do it a lot. Excuse me, my voice.
Great points, Dr. Kearney. That brings us to a discussion on measuring progress. So when you're exercising, if you want to know if your exercise program is working for you, it's working to improve your health, it's great to measure progress. So some things you can measure include the time it takes you to do an exercise, the distance you're able to go, and the intensity you're able to tolerate. So you can measure that by looking at how did you feel when you were doing this? Were you super out of breath? Did you feel okay? How did you feel after? How many breaks did you have to take? So an example is in week 1, if I decide that I want to exercise by walking, and I decide to do a 1 kilometer loop, and I find that, oh, it takes me 40 minutes. And then when I look back at that actual activity of walking that 1 kilometer, I go that, oh, I had to take 2 breaks when I walked 1 kilometer. So I keep doing that for the week, and then the next week I choose to test myself again. So I walk the same 1 kilometer, I find that, oh, it's taking me 36 minutes now, and I only had to take 1 break. So clearly walking every day is kind of building up my tolerance, and I'm seeing some sort of improvement. Now, it might not be an improvement that you're seeing week to week. Sometimes it might take multiple weeks, could take months, but that progress is really important nonetheless and kind of shows you a positive trajectory of where you're going. And finally, for the Kansas City cardiomyopathy questionnaire, this is something Monica brought up, that the 6-minute walk test is something that you can use for predicting your prognosis. So basically, a small change in the 6-minute walk test would give you 5 points. And a simple approximation is that each 5-point improvement in this questionnaire is associated with a 10% reduction in the risks of mortality and hospitalizations, a 100-meter increase in your 6-minute walk distance, or a 2.5 milliliters per kilogram per minute increase in your peak oxygen consumption. So you can see that improvements in this test is actually predicting like a better chance when it comes to looking at your long-term mortality or hospitalizations and things like that.
How do you measure VO2 max? Do you know how to do that?
I don't personally know how to do that, but if anyone else wants to chime in on that, go ahead.
Sure. So basically you take oxygen and you convert it to energy, and that's horsepower. We once a week, I do it at the Hamilton General Hospital. It's called a stage 1 stress test. You can do it on a bicycle or you can do it on a treadmill. You put this mask on your face and you look at oxygen consumption and you see how much work you can do. So you can see your carbon dioxide come out, your CO2. You can see your oxygen coming in. You can actually do this. It's a kind of a fun test in one sense, but it's really very scientific. But you don't need to do that. You can just look at the 6-minute walk test. It's just totally amazing what the 6-minute walk test can predict. And so I think you should look at it yourself and just every couple of weeks, I'm encouraging people for the next 3 months, every 2 weeks, try to do a little bit better. Some people, do these, ultra marathons, and your ultra marathon could be a 10-minute walk or 6-minute walk to start off with. But walk in 6 minutes and see how many steps you can do, or what distance you can do. Really important, and have some fun trying to get better. You can actually improve it by 25% very, very quickly.
Yep, thank you, Aditi and Dr. Kearney. Now we're just gonna go on to what should we track about our health. So we've talked about tracking our health and making sure that we're making some lifestyle changes, but like how can we measure these? Well, the first thing that we want to talk about is potentially creating a CHF checklist. And now you might be asking what this is. Well, this is just to make sure that you're covering the bases and doing what you can every day to alleviate some of the burden of CHF. So a major thing is making sure that we're staying hydrated, especially when we're exercising. But even more than that, we should be having about 6 to 8 glasses of water per day. Everyone should be, but if you have CHF, it's definitely very important for you specifically. There's also making sure that we're checking for swelling in the feet and ankles, making sure that we're checking our medications, and we're eating foods that are low in salt or salt-free, and also balancing our activity and rest periods. So this promotes us to not hold our breath and allow us to really pair that good breathing with the exercise that we're doing. As Dr. Kearney mentioned earlier on, actually, he was talking about our BMI and weight, and that is a very good way to really help alleviate some of those symptoms. So what we're going to do is, if you've, I guess, tuned into our previous webinars, you know that managing our weight is very important, especially if you have CHF, and that's because when your heart doesn't pump properly, you can have this fluid accumulation and backup in your body, and this can lead to you actually gaining extra weight. So measuring your weight is relatively easy to do if you have a scale at home, and there are just some tips that you should probably just consider when you are deciding when you're going to weigh yourself. So first thing, you should use the same scale every day. There are minor distinctions and sometimes even major differences between brands, or even just the same how much you use it can determine whether or not there are going to be variability. So for example, me having the same model of a scale at my house and then going to my mom's house and having her scale, it might be completely different even if it's the same brand. So try to use your same scale every day. Weigh yourself while you're undressed. Weigh yourself while you're undressed or wearing the same type of clothing. Again, can help you really to make sure that you're getting that relation between if you're gaining or losing weight. And there are a lot of different ones, but for the sake of time, if you want to screenshot, this is a good reminder to have. And make sure that you're doing it with your dry weight. So try to not weigh yourself right after you eat, especially big meals, or right after you drink a lot of water, because these can really skew the results. So a lot of people like to weigh themselves in the morning, just to keep it consistent when they haven't eaten a big meal before they wake up, kind of thing. When it comes to scales, you have different types. So on the far left, you can see an analog scale, and what this is that you stand on it and you there's this little dial thing that turns, and then you kind of have to match that up with where the arrow is pointing. So this is usually the cheapest model, but it doesn't always work out well for people who aren't able to see that far, or have other conditions that prevent them from bending over to really get a good look at the scale. So for those individuals, it might be easier to get a digital scale. Now a digital scale has, depending on which ones you get, I know there's some that are really big, super large numbers. That way you can really see them. And those are really great if you want to, continuously check your weight and make sure you're doing so accurately. And lastly, on the far right, you can see there's this new type of weighing scale called the body fat scale, and this is a little bit more specialized, where it not only tells you your body weight, but also gives you an estimation for your body fat percentage. Now, how this works is the device will shoot a very, very small, I can't stress how small, electrical current through your leg that will measure the resistance based on your fat, and it will give you a rough estimate of your fat percentage. And now this shouldn't be used as a very precise or accurate statement, but it will give you a ballpark of how much fat composition do you have, and if you're losing fat mass, or if you're losing other forms of weight, such as water weight, or muscle tone. So it kind of gives you a rough estimate there. Now, when we're talking about BMI, as Dr. Kearney said, we were mentioning, 25, below 25 is something we should shoot for. So how you can decide those is a variety of ways, but for here, this is on the right, you can see the BMI scale for your height in weight in feet and inches, as well as centimeters, or also pounds and kilograms. So this is a great resource if you want to even check out for yourself. So just an example, like for me, I am around 5'6". I'm very glad we're online, because a lot of people say I'm very short in person, but I swear I'm 5'6". But I'm 5'6", and I weigh approximately 130 pounds. So you can see, if you trace that line, I am at 21. So I'm in this green section, which is considered healthy, and it's below that 25 that Dr. Kearney said we should be shooting for. So I gotta keep going, or else if I let myself slip, I might go underweight or overweight, and these can increase my chances of specific illnesses, or just in general different symptoms. So I would encourage you to go check this out for yourself, see where you fit upon that, and try to set some goals for yourself. They don't have to be big goals, they can be small goals, and slow and steady wins the race, as my dad always says. So making these small changes, and they can make a profound impact in the future. Another way you can check is waistline. This one's a little bit more difficult, because we don't usually measure our waist, but if you do, you can check your height and compare that to your weight. So again, I am about 168 centimeters, I think. I think that's like 5'6", 5-ish in inches. And if you check, I am about 70 in terms of my waist. So I am also in that green. So that is still healthy, but as you can see, I'm a little bit borderline on the brown, which is underweight, and then yellow, overweight, and so on and so forth. So these are just good ways to gauge and estimate how you're doing in terms of your weight. If you want, there's also a plethora or a lot of body mass index calculators online. It's really, really easy. You put in your weight, you put in your inches, it'll put it in this little equation, and then how it spits out your BMI. And as Dr. Kearney mentioned, these are kind of the weight categories that you want to shoot for. So normal being 18.5 to 24.9, and then overweight being 25 to 29.9, and so on and so forth. So seeing where you fall on that can really be helpful. Again, I mentioned this is a rough estimate. So some people who might have higher muscle mass, so for example, bodybuilders or women who generally have a higher fat percentage, may actually be a little bit like they may present as overweight but really be normal weight. But that's, again, something you should talk to your doctor about and see if that's kind of the case for you.
So thank you, Matthew. I really found that very helpful, because I like that table there. I'm somewhere between 5'10" and 5'11", and I weigh about 165 to 170 pounds. That gives me a body mass. So, Stuart, if you go there, I'm between 5'10", 5'11", depending on the day of the week, I guess, how straight I stand up. And I'm somewhere between 165 to 170. So that puts me around a body mass index of 24. Is that right?
Yes, 24.
And so you can see that, and 24 is some, is that, and in the range, and you can say, well, I just have lots of muscle. I got a big muscle in my tummy. That's, I don't think that's a real muscle there, so I'm trying to work on that. And if you think you have more muscle, get one of those scales that gives you your composition of your body, and check in on that. Once your body mass index goes above 25, your risk goes up. And I'll just say this really, really surprisingly, is that unfortunately, one of the predictors of dying from COVID is getting older. Second, big predictor is body mass index. So the people that end up in the intensive care units mostly have body mass indexes over 23. So once you get over 30, 35, you're in big trouble. And that leads to cancers, heart disease, to stroke, other infections as well. So I know we're all used to seeing us being at more heavier weights, but love yourself and love less of you, and have fun trying. And don't measure yourself if you'd like to. Some people measure themselves every day. Some people measure themselves once a week. If you have congestive heart failure, I think measuring yourself every day is not a bad idea. And if you're gaining more than 2 or 3 pounds, that may be fluid. You may need to do something about that. So thank you for sharing that. Measure it.
Okay, so now we're just going to talk a little bit about blood pressure. And this is something that's pretty unique. So with congestive heart failure patients, something important to do is to measure your blood pressure when you're sitting, but also when you're standing. You might ask why this is. It's because there's a pretty unique phenomenon associated with CHF, and the fancy name for this is orthostatic hypotension. But a great way to explain it is basically, when you do stand up, you might feel something like a head rush, or you might feel lightheaded, and that's due to a low blood pressure. And what we've seen is that this sort of phenomenon happens a lot more with congestive heart failure patients, and when they do stand up, their blood pressure can actually drop by close to 20. It's 20 mmHg, which is just millimeters mercury, and it's just the way we measure blood pressure. So as a result of this, it's one thing to note is just to be careful about when you are taking your blood pressures, that you do it when you're sitting, but also when you're standing. And you can do this in your home with your portable blood pressure machine. And one good thing, especially now with COVID, is not to rely on going to the pharmacy and doing it there, or going to Walmart and doing it there, or waiting for your doctor's appointment. Is to try to get your own blood pressure machine, because it is very vital, and it's one of the greatest things that you could do right now for yourself. And the way you would do it is, first you would spend 5 minutes lying down, and then you take your blood pressure readings. Then you can stand up, and within a minute try to take it again and see if it does fall by 20 millimeters mercury.
So I think it's very important to really measure your blood pressure, measure it often. Blood pressure should change. If your blood pressure is always the same, two things: you're not measuring it properly, or you're dead. Is that blood pressure is designed to measure when you're relaxed. So you see on your far left, you're sitting, you're relaxed, no coffee or tea, your bladder's empty. I always laugh when someone says, well, I didn't measure my blood pressure, but I'll measure it while I'm on the phone with Dr. Kernew. Guess what? That's not the right way of measuring blood pressure. It will be higher, or it should be. So please measure your blood pressure multiple times, because the first one's a little bit higher, it goes down. So really spend the time to look at this. And if you think you're getting dizzy, measure your blood pressure sitting, lying, and standing in different positions, and write that down. Ideally, at some point in time, you should measure blood pressure on both arms. They should be the same, or within about 10 millimeters difference. If they're greater than 10 millimeters difference, there's usually a blockage in some vessel in your body, and you have to take the highest blood pressure reading to tell what your brain and your heart and your kidneys are getting for perfusion. So this is your standard workhorse. And also too, if I'm giving you medications for congestive heart failure, they affect blood pressure. As we talked about initially, that being on high blood pressure pills is a marker for congestive heart failure, and not controlling blood pressure is even worse. So every 10 millimeters reduction in blood pressure down to 110 to 120 systolic range, you lower the risk of congestive heart failure by about 30%, stroke by about 20%, and 10% for a risk of having a heart attack. So you get dramatic benefit from lowering blood pressure. And questions for the group is, what's the best blood pressure measurement? Is the one in Dr. Kearney's office, your home, or that 24-hour beat blood pressure machine that you kept as may wear for 24 hours? What do you think is the best thing for most of us to think about? Any takers? Time's up. It turns out is the daytime average over 24 hours is probably, in that machine, is the best predictor for things like heart attacks, strokes. But you know what? And that only measures it just at one time over 24 hours. And most places charge a lot. We charge a little bit, and we're not trying to make money. We're just trying to get you to. I'd rather you get your own blood pressure machine. I can trust that your measurements are accurately and done reliable on a regular basis, and that would be the best thing for all of us to have. So, to me, is that next to your emergency kit, should have a scale. If you want a fancy scale with body composition, terrific. If you want a digital or a old one, I don't care. Just use the same scale on a regular basis and use it. The blood pressure machine, wear it out, measure it multiple times, but you need to have a proper blood pressure machine if you're really serious about your health. Fire away.
Perfect. And here we just want to one more time go over how to read the blood pressure machine. So your top value is going to be your systolic, which is the pressure right as your heart pumps, or right after your heart pumps. The diastolic is actually when your heart is relaxing. And the last one, the pulse rate, is basically, in a way, the amount of times your heart is beating in a minute. And the ideal, I've heard the ideal is between 110 over 70 and 120 over 80. And with the pulse rate itself, 60 to 100 is normal, but we definitely like to see lower values because those are attributed with less amounts of cardiovascular events. So that's just a very quick tidbit on how to read a blood pressure machine.
So John Deacon was asking when to measure blood pressure. You want to measure blood pressure when you relax. Usually first thing in the morning is a good time. You get up, you're more relaxed, you go to the bathroom, your bladder is empty, and you go to the kitchen table and put the blood pressure machine in your arm at heart level and go ahead and measure 3 times. The first one I would never actually really look at. It's the second and third one that become important. But if you know that value is changing, then keep measuring. And be mindful about recording these values, and get a book. It's amazing, people write it all sorts of little pieces of paper, but I'd rather you just go to the dollar store when you're allowed to be in the dollar store and get a book where it's a few hundred pages, and just keep track of important information from your medications, the questions you want to ask, and take the notes from the webinar that we're hearing today. And don't forget the pulse, the heartbeat. That's kind of important too as well, because we want to know what that is. And measure different times of the day when you relax. End of the day is a good time too as well. And it's the totality of the average blood pressure that's important. My blood pressure went up to 150, 160, 180. That's good. That's normal. But my blood pressure went down to 90. That's good too as well, because blood pressure varies. And don't forget, these machines are non-perfect. They make mistakes as well. So that's why you want to get the average of it. So a lot of people say my blood pressure was 90 on the machine. In fact, you had extra heartbeats, or it didn't properly measure, and it either gives you an error message or it gives you a false reading as well. So never rely on 1 or 2 values. It's a series of values. It's important. One of the things we don't do well is that postural blood pressure effect, because you're getting water pills from us. And that can actually deplete you of some of your blood pressure effect. So we can actually give you too much. So that's really helpful to do. Thank you for sharing that.
Dr. Kearney, does it matter if we measure blood pressure right after we eat?
So after you eat, it's probably not the ideal time to measure blood pressure, but it's interesting you mentioned dizziness. What happens after you eat is that your blood goes to your stomach to start digesting. So that can actually lower your blood pressure as well, and you can compete for blood pressure to your stomach versus your brain. And some people get these dizzy spells like an hour after they eat after a meal. So be cognitive of that. Is that so you just have to. So you certainly can measure it, especially if you're having symptoms. Also, too, if you notice that you get dizzy when you get up quickly, get up slowly. Sit at the side of the bed. Sit there. Move slowly. Don't be afraid to have a walker to help you too as well. So yes, you can measure, but ideally it's not the best time to measure it after you're eating, because that can be falsely low a little bit, because you're competing for blood going to your stomach versus the rest of your body.
Okay. So here's just a small little tidbit that we wanted to add. We really talked about our different treatment options in our last webinar, and you're free to check it out. As Monica showed, we have a full playlist on YouTube that you can look through. We just wanted to add this small little piece right here on iron therapy and heart failure. So, interestingly, the goals of iron therapy and heart failure are threefold. It's to, one, make you feel better, so improve your symptoms and improve your quality of life. Two, it's to reduce hospital admissions. And three, of course, it's to increase survival, which is to really reduce your mortality and your premature death. And so, what does the evidence show? Really, the evidence on the next slide, we'll see that the evidence is in favor of iron therapy in heart failure. And I know this slide looks really complicated, but a really easy way to understand this is, in this study, they had close to 550 patients. Half of them got the iron medication, and half of them got a fake medication which looked like the iron medication but had nothing in it. It could have just been a sugar pill or something like that.
Out of 1,000 patients, half got...
oh, right. Yeah, sorry about that. So 1,000 patients, and around 550 were given either the iron, or 550 were given either the placebo. And what they found was that there was no difference in cardiovascular death, but they realized that there were only 217 hospital admissions in the iron group compared to almost 300 in the placebo group. And that value was actually statistically significant enough for them to conclude that fewer days were lost due to heart failure hospitalizations and cardiovascular death in the iron group. And so if we go back to the goals that we had set, we can really see that we've achieved that goal of fewer days in the hospitals, fewer hospital admissions, a similar amount of death. So that wasn't really achieved as much, but it was still the other two things were definitely achieved there. And if we go to the next slide after this one, we can see that this isn't the only trial that's done it. And I know this is another very complicated looking slide, but the only really important piece of information there is the trial name. You can see a year behind it, and you can see that there's been studies done in 2009, 2015, and 2 in 2017, which have also concluded the same thing as this AFFIRM trial did in 2020. And that's just something we want to kind of drive home, that this is definitely something that you can look into, and if this is something that very, very much does interest you, you can definitely talk to Dr. Kinney about that.
So this is actually what I call preliminary data right now. Remember we talked about the COVID vaccine. These are trials of 30 to 40,000 people. These are trials of a few hundred people. In the field of cardiology, this is not huge trials, and but it really suggests that giving iron, and mostly infusion of iron therapy, might keep you out of hospital, and it improves your quality of life. So the best way to measure iron is something called ferritin, and ferritin should be above 300, and so if it's less than 100, you're definitely iron deficient, or can be. Between 100 and 300, we have to measure something called transferrin saturation. You can see on the top about that. That's what my job to help you with, so that suggests that you're iron deficient. Now, ferritin is also a marker for inflammation that goes up too as well, so it's not always totally reliable, but certainly an important consideration to look at that. I'm starting to do that more and more. It hasn't reached standard care yet. There are more trials coming out that are bigger, more definitive, but it looks very promising that iron therapy, predominantly iron infusion by the intravenous, looks the best. So what I'm trying to do is how do you get more iron from food and things of that nature as well. It's important. And if you're losing iron, are you bleeding somewhere? And the bleeding part, we worry about bleeding in the bowels. And one of the concerns is, do I have a tumor? Do I have a cancer in my bowels? So sometimes we have to go looking for that. But when you have congestive heart failure and you get older, the bowel gets friable and it just leaks as well. So it doesn't always mean it's a cancer, but it's decide whether or not we have to go look for that as well. So exciting information right now. So I'm going to get Didi to tell me again is what the food rich is in iron, how to get good iron from my food outside of red meat, and we're going to talk about more of that on Sunday as well. So eat your beans, and let's move forward about that. Yeah, go ahead. Thank you. Tell what's next.
For sure. And next we have a couple of interesting new technologies that you can really think about when it comes to just, being on top of your cardiac health. Here we've got an app called Anura. And what it does is that it takes a 30-second selfie, almost like a video, and it uses artificial intelligence to help determine things like your pulse rate, your blood pressure, and much more. So we do have a little video here, and let's hope that it can be played just to see how it works.
So it asks you to take a 30-second selfie. So if you have a phone that has that front-facing camera, you hold still, and then after that it will show you some results. So it can even tell you if you're feeling stressed, it tells you your BMI, general things like this, and it can track it for you. But it's not necessarily the most accurate tool. But it is a very interesting app. And it can kind of give you a ballpark of maybe where you would, what values you would get out of it.
Right, exactly. So I would say, don't replace your blood pressure machine with this app, but use it as a secondary. If you're at a situation where you can't use a blood pressure machine, or if you want a second opinion or a second reading, this is something that you can look into.
It's kind of cool. I have it on my phone, and I use it, and I'm just trying to figure out if I can replace the blood pressure machine in the future or not. We'll see how that comes. I don't feel confident enough right now, but it looks pretty good. So wow. So here's what your cell phone will tell you soon. I want a cell phone that makes me smarter. I'm waiting for that app there.
Perfect. Then we have something along the same lines, but a little bit different, called Cardia. And this is actually a portable ECG or an EKG. You might hear either two of those. And you can kind of connect this to your phone, and there's an app that goes along with it, where you can basically take your own EKGs on your own, and it even has an option to kind of record it and to see what's going on, and it can really detect things like AFib or atrial fibrillation in under 30 seconds. Just again, something very neat. And if you do want to spend your money on something like this, you definitely can. But if not, we definitely do things like this at the clinic, and that's just something that extra that you can kind of look into for sure.
I kind of like this technology. It's emerging. I just did my blood pressure with the Anura. I got 132/77. I'll do a couple more and just see how it comes out right now. I'm not sure doing a webinar is the right time to measure your blood pressure, so it's kind of interesting there. And so we're actually going to be doing a little project. We're going to probably get about 25 to 30 of these devices and loan out from time to time, but get your own if you'd like to. It's about $100. There's a 1-lead system and I think a 3-lead system. or a multi. I can't. It's a one in a multi-lead system. John Deacon's on there. I can see which he's a guru of this, and he showed me this to start off with, and they may have a comment a little bit later about that. Hey, John, do you want to say anything about the cardiac device at this stage, or a little bit later? What's your thoughts about it? We'll get his comments later. But really importantly, when you get it, you can actually print it out. So my advice to you is to print out all the strips that you want. And people work differently. I would prefer to see you in person with your strips, and we can organize a visit, whether or not that's a good thing. This is actually good for people who have these intermittent palpitations or symptoms of their heart racing that you don't know what it is. It is FDA approved to detect something called atrial fibrillation, which is important. The Apple Watch is also approved too as well. Apple Watch, I think, is $600. This is around $100. So these are things these are new tools, and you get more of these tools. Anything else you want to say about this, anybody?
I just think it's a very, very interesting and promising piece of technology, and I think it can possibly shape, the way we do things in the future. But this is definitely very, very interesting.
Can you hear me now?
We can. Go ahead, John.
Oh, okay. I use it every morning. At the end of the month, the company takes the recordings that I've done for the month, combines it into a report, and I get the copy of that report and send it to Dr. Kernew. So he gets the readings of the electrocardiogram, a sample of it, plus the other data that's stored in that app. So I find it a lot of fun to do. I do it first thing in the morning, and it's been mine has been pretty steady, but I have occasional extra beats or skip beats. So and I see those. So it's interesting.
So one of the things, my advice to you is that I have 7,513 emails as of today that I haven't read. So if you're going to email it to me, I'm probably not going to be able to look at it in any timely way. Within 2 years, I'll probably have a peek at it. So my advice to you is to make a copy of it, a paper copy. Now you pay and organize an appointment. You can always call the clinic if it's a concern. We're always available for that. One thing I'm going to plead for people: don't call me on my cell phone when during clinic or any time unless it's an emergency, because I'm talking to somebody else. You can certainly text me and put who you are on there. But if you need to get a hold of me, I have wonderful people at the front, and you can email it to drkernew232@gmail.com with your name, birth date, so we can run the chart. You can call Jen or Stephanie or anybody at the front desk. We'll be happy to. One of the worst things is if you call me in a conversation with somebody, I'm concentrating on that person, and then I have to hang up the phone on them, and I don't know who the hell I'm talking to, and I don't have your chart in front of you. So I like to do things one thing at a time. As I get older, my brain tries to concentrate on one person at a time, and but certainly always available for emergencies. And this is a good device for yourself. And we'll actually do a webinar. We already have a webinar on our YouTube channel about this, and we'll have more about this. So I'm excited about this technology, but it makes mistakes. It's not perfect. A lot more artifact on here as well. So exciting stuff that you can learn. Thanks. Well, John, what's the subscription fee you have to pay for the cardiac device?
I pay an additional $100 a year for that, or $120 or something like that.
So the device is about $100 to $150. There's two devices. What are the two devices again?
I think the first device was just under $100, and the other one was $130 US. Now I don't know whether they're selling them in Canada at a different price. I bought mine through the United States, and it's a 6-lead attempt at a 6-lead. The one that I'm using now. So
6-lead means it tries to give you 6 looks at the heart. So when we do our Holter monitors in clinic, we use something called a 3-lead system. The cardiac device uses a 1-lead system for that. So there's more room for artifact and these sorts of things. So it's always had multiple looks about that. When we do a cardiogram, we standardly do a 12-lead ECG. So and obviously our quality will be better because we might shave you a little bit if we need to and have good contact. So this device is really quite amazing for what it can do. It's not perfect, makes mistakes. And what I notice with some of these devices too as well is that sometimes we can call artifact mistakes for something that we think is right or wrong. So it takes a little bit of finagling to understand these things as well. But really, really encourage you to think about that. Great stocking stuffer for people and anybody with a rhythm problem. It's a good thing to have. But you have to be able to be awake and be there to do it as well. So if you pass out, we're not going to know because there's nobody to monitor that for you. I think that nature as well. So very useful technology.
Okay. This is just a small little checklist we have. You can do this almost every day. You can look at your weight. You can look at your blood pressure, kind of note the difference between the weight on a day-to-day basis. And then some of the things that you should be kind of doing every day are drinking 6 to 8 glasses of water, taking your medications, trying to see if there's any swelling in your feet or your ankles and your legs, and hoping, and seeing that there isn't. Eating foods that are low in salt, and then also balancing your activity and your rest periods. And then with all of that, you can kind of see what kind of zone you're in. This is just a sneak peek of something that we'll talk about a little bit later in our webinar. And I think with that, I'll pass it off to Matthew.
Yep, thank you, Nirmay. Now we're just going to go into some actual tools that you can use to track and manage your health. So next slide, please. Thank you. So first, we just want to talk about the different stages of heart failure. So it is progressive, and we were talking a lot about 5-year survival. And unfortunately, it is quite sad when you're in the very, very advanced stages, known as stage D, based on a classification system. You actually only have about a 20% chance of surviving past 5 years. But if you can slow that progression and maintain, these changes to your lifestyle, you can actually increase that up to, 75% at 5 years, or even 96, depending on how early you catch the disease. So I don't know if Dr. Kearney wants to mention anything about this, but I know that this has been something that is a big push to really help you guys decide to make these lifestyle changes and really take control of your CHF.
So we see often people at class C or D. That means you have symptoms of heart failure. You may be the predictors of mortality from heart failure is being hospitalized. And if you've had 2 hospitalizations for congestive heart failure, your survival is probably 1 year to 2 years on average. The next is that we can look at how strong your heart muscle is, and we have those webinars to look at that. And we have really 6 different medications to make you live longer. It's like a basketball team, and they're all superstars. They work in combination. That's why you need to measure your blood pressure, you need to measure your weight, and get some blood work, because we have to manage this well, and they affect blood pressure. What I'm talking to most of us is stage A and B is my hope for you. So if you have diabetes, you're overweight, you have high blood pressure, you're at stage A right now. When we do the echocardiogram, we can actually look if your heart muscle thickened, the elasticity of the heart. You mentioned that exercise increases elasticity. Well, what happens as time goes on, the heart gets weaker and it loses its elasticity. And the best ways to do that is keep your blood pressure low. That's why you have to know your blood pressure on a regular basis and keep your weight down. If you have atrial fibrillation, that's a marker that your heart's in trouble. You've already doubled your mortality. So I can see lots of people at stage A and B. You can see yourself at stage A. Just by being over the age of 60, your heart's starting to lose its elasticity, starting to wear out. And if you have high blood pressure and you're overweight and not exercising, you're probably at stage B at least at this point in time. The clock's ticking. And if you're short of breath. So if you're 60 years plus and you're short of breath and you're taking 2 pills for high blood pressure and your body mass index is 70%, your body mass index is over 30, you have a 70% chance that you have active congestive heart failure at this stage. So my plea to you is, why are you waiting? So many people say, I felt great all my life. Now I'm, 75 years of age. I can't do too much. I have no energy. I'm weak. Why is that? Well, it took you 70 years to ruin your heart and your body. So it starts the day you're born, so take care of it. Now, you can get some of it back, but not all of it back. And, the best way is that, Lance Armstrong used to be one of my heroes until I found out he was a cheater. But basically, one of his goals to get faster was to get lighter. And it makes sense. If you're flying an airplane, the amount of fuel on board is dependent on how much weight you're having. Your car wears out quicker if you overload it. So we overload our bodies on a regular basis. And that 20 to 25 body mass index, very few of us have that anymore. But you know what? Let's get there, and let's have fun trying. And if you want, we can tell you if you have had an ultrasound test, if you're on that pathway. And the other test is that blood test called BNP or pro-BNP that can give us some clues as well. And the other clue, too, is that when you damage your heart, you're probably damaging your kidneys. Everybody's looking at their kidney function. Why is my kidney function getting worse? Well, I'm getting older. It's wearing out. I have high blood pressure. I have diabetes. I'm overweight. I don't eat properly. Your filter, your kidney is wearing out as well. So let's don't wait till till everything falls apart. If you're a C or D, you're in trouble. But there's so much you can do to make that better. So thank you for sharing that slide. A very, very powerful slide here. Don't wait till it's too late.
Yeah, thank you, Dr. Cornu. Couldn't have said it better myself. I guess on the next slide, we're just going to continue on and see that, we, as Dr. Cornu mentioned, taking control and really identifying where we're at risk can be a really good step forward to preventing us from getting to those later stages. And there, as Nirme mentioned before, there are a lot of cool advances for monitoring health. So, the Cardia and Acura, everything like that is great. But sometimes there's also more low-tech and more, well-received resources that we can actually be implementing now that can really help us with different aspects of our management. So, for example, identifying symptoms, using our appropriate medication on time, as well as our lifestyle changes. So I'm just going to get into those on the coming slides.
Matthew, thank you for talking about high technology. The best high technology you can get is a scale and a blood pressure machine.
Exactly, yeah. And this is another good thing to look at for your actual self-check plan and HF management. As Dr. Kearney said, it's not always that you're going to be super symptomatic, because when you get those symptoms, you might be at those later stages. So trying to look at and be aware of what the symptoms are, and these little tidbits or clues that you might be nearing that can be really helpful for helping with an early diagnosis or even preventing it from progressing further if possible. So this is the guidelines from the American Heart Association, and these really help you to see how and be aware of different things that might be affecting you. So it breaks it down into excellent versus pay attention symptoms versus medical alerts. So especially if you are in those later stages, this could be a great help for determining, when do I have to go to the emergency room right now, and when is this a severe emergency kind of thing. A good trick for this is actually trying to familiarize yourself with it and putting it into your regular routine. So, adding 2-minute checks to your day, and what I like to do is put it right in a place where you're going to run into it, and it'll kind of force you to check it. So, for example, you can see down here I have, the fridge or the freezer. So, when you're going to get food, get something from the fridge or freezer, you can check, okay, just quick check, making sure I'm doing okay, no symptoms or anything, just puts you into that mindset. Likewise, you can also put it on the phone or landline, and this can help you if you need to call 911 and explain your symptoms. Okay, I'm feeling this, or calling Dr. Kearney, I'm feeling this. These are my symptoms. What do I do now? And lastly, you can also do in the bathroom, because a lot of people have their scales in the bathroom. As Dr. Kearney said, scales are your best friend to make sure that you're tracking your weight. And the next slide is, we can see these are more on medication side. So the Shoppers Drug Mart app is quite good, and from what I've heard is quite user-friendly. On it, you can manage your prescriptions, and you can also, it'll provide you with automatic reminders when you need to refill. And depending on which type of drug, and I guess the communication with your prescribing doctor, it can actually even auto-refill for you, so that way it can save you some of the hassle, especially if you have multiple medications. As Dr. Kearney mentioned, with the super team of 6, it can get a little bit hard to track. And additionally, you can also add family members, so if you're going to make one run to the pharmacy, you can get all of your medications at once.
This is important, is that less than 20% of charts in doctor's office are up to date and truly accurate, because things change, and most people don't take their medications properly. One of the reasons I am so far behind is every day we get probably at least 10 individuals who've run out of medications. When you run out of medications, it means that you run out of gas, and you have to rely on somebody else, someone like myself, to renew them. Or the pharmacist can renew them, they'll charge you a fee. I am getting overwhelmed with COVID-19. I am talking with people that are very sick, who have had the disease and have other consequences of that. And you're taking time away from that. I'm very happy to deal with your emergencies and all your wants and desires, but you need to actually, it says here, refills left 1. You need to know how many pills you have left, how many refills. So when you discuss with me over here, say, Dr. Kearney, I'm taking these 6 pills, 3 are from you. Can you? And I have enough for about 4 months for one and 12 months for the other one. Let me renew them all at the same time, and we can get back on track. It's easier for you, and it makes sense. And let's see if we need to adjust anything. Know which doctor is responsible. I rarely say no to medication renewals, even for medications that I don't prescribe. I won't prescribe narcotics. I won't prescribe sleeping pills because I don't know enough about them. And certain medications I won't prescribe as well. So I beg you, I plead you, is keep track of your pills. They're your pills, and the pharmacy, or you'll know when I run out. The answer is no. You need to know when you're running out of pills. You don't tell the tow truck bringing you the gas is that tow truck, you're responsible for towing me when I'm out of gas. So I don't know why we've changed that in some way. And I'll help you in any way I possibly can, but for me to help you best is I need to understand that you're taking your medications, that you know what the medications are, and when you're running out of medications. I don't think it's too much to ask for that. And especially now is that let's all work together to find out. And if you don't want to take a medication, tell me. I'll figure out if it's the right thing or not. I am really amazed of how non-experts have decided what's best for them. So I'll share my experience with you, and it's up to you, but make the right choice at the right time.
Yeah, and in addition to, I guess, the refills, we also need to remember that we need to take our medications, which is, they're prescribed not for fun, but because, we need to take them at a certain amount of time. So I'll show you what I guess is a good way to do this on the next slide. You can see here that I am a very disorganized person, and so Google Calendar and Apple Calendar has really saved me from a lot of trouble. So this would be a good place to stop if you're watching on YouTube, and just really take a picture of when all of the slides come up, so that way you can see how to set your own reminders super easily and make sure that you get these notifications that you're taking your pills properly. So the first step is, you can see you're just going to go. I did this based on Google Calendar, but it's pretty similar for Apple Calendar. So you can go on your computer to your Google Calendar, which just connects to your email address, and you click on the day and time for your medication. So you can see here that I picked May 10th from 9 a.m. to 10 a.m. It doesn't really matter the time as long as the first part is what you're doing. So at this time, I'm going to take, for example, metoprolol, digoxin, and spironolactone, or something like that. And you can fill that in with whatever medication you're going to take at that time point. And what you do is you go and instead of event, you go to reminder. And you can click how often you want to repeat. So if Dr. Kearney tells you it's going to be a daily thing, then you click daily. If it's weekly on every Monday, then you're going to pick weekly, or monthly, or annually, which probably will never happen. But there's a lot of things you can do. And once you click that, you click save. And lo and behold, this is the screenshot you're going to get. You're going to get these little reminder things that will give you a notification every time you need to take it, so you're not missing any of your medications, because as Dr. Kearney mentioned, they're your fuel. So if you're not taking it, you're obviously not going to run as well as you would if you had taken that. So this is a really good way. It's easy, it's free, and if you have any problems with that, then it's relatively easy to solve. So that's just one way of doing it. If that's not something you want to necessarily do, on the next slide we have a MediSafe pill reminder. This is a specific app that does exactly what we've stated. I think it's free, but it says it has in-app purchases, so there may be some costs associated later on. But this does the same thing and just sends you notifications to take your medication. Another important thing on the next slide is that we have people who have diabetes, or for example a mechanical heart valve. You might have specific things that are important additionally to your CHF medication. So for diabetes, it's really important that you might want to plan reminders for time to take your snacks, or to perform glucose testing, or inject your insulin. So these are things that you can also use on through a variety of ways. So you can use your Google Calendar and a personal log. So that's having your notifications and then writing it down on either a piece of paper or having your own running spreadsheet. Or you can use something called Freestyle Libre, which is something we've piloted a lot at the clinic. Or you can use other diabetes apps to track that. And in terms of INR, which is really important for people who have mechanical heart valves due to problems with thrombosis of the heart valve, you may be asked to take these at home, or you may be going to a clinic for them. So it just depends on how your patient, how your doctor tells you to work on that. But if you do need to take your INR measurements or prothrombin tests at home, then these are some apps, for example, MDINR or INR log, that you can use to check for those. Lastly, we're just going to go to some apps and resources for lifestyle changes. So I found a statistic that showed that those continuing to smoke when they had CHF saw an increase in mortality by 38% and rehospitalization by 44.8%, compared to those who either quit or were non-smokers when they had CHF. So smoking is a very important thing that you might want to cut back and completely eliminate if you have CHF. And even if you don't, it's very good to just engage in smoking cessation behaviors. So there are many resources available to you, including apps called, for example, the Smoke Free app, which allows you to help visualize your progress. For example, showing you years saved or amount of money saved. It's different in terms of that sense. Or you can also have join Dr. Kearney's smoking cessation webinars. We actually have a group that covers these topics. So if you want to be informed about this, the group and the webinars we're hosting for that, please just feel free to message us with expressing interest that you would want to be part of this. And lastly, there's also a lot of hospital resources, including from St. Joseph's, that will link you to community-based in Hamilton smoking cessation groups, as well as support groups that you can go to.
Yeah, so if you want to stop smoking, let's work at it. It's hard. There's an addictive problem and there's a behavior problem as well. So remember, every cigarette has between 5,000 and 7,000 chemicals that are bad. If you smoke, 60% of individuals will die from smoking. It will affect you in multiple ways. It shortens your lifestyle, lifespan. And we'll help you too. We have a team of people that if you want to stop smoking or want to cut back on your smoking, we can help. But make the first step. And by the way, I just look at this Nuric app again. So I measured about 5 or 6 more blood pressure. So again, it varies between 135 to 124. So my average blood pressure is 125 over 73 during a webinar. So it's not the ideal time to take it, but it's, if I just relied on one value, I don't do well to do multiple values. So measure your blood pressure. And the first important thing is a scale, blood pressure machine. And the third high technology equipment you should have is good walking shoes. And a non-stick frying pan would be my next thing for you.
Yeah, it's funny you mentioned non-stick frying pans, because actually the next slide is about weight management and healthy eating, which I know is a very big topic we should be talking about today. For those of you who I guess missed it at the beginning, there's going to be a cooking club Sunday dinner. It's a very, very wholesome name, very wholesome time. So please come if you are interested in learning how to cook healthy and also on a healthily and on a budget. Dr. Kearney's there. Aditi, who presented earlier, is going to be there. And there's a lot of things that you can look on at the Dr. Kearney's YouTube channel, where he goes over things such as the Pesco Mediterranean diet, plant-based eating, and finding out whether or not dieting is for you, or if soups and smoothies, integrating it slowly, or cutting out things cold turkey. It depends on what you decide. So definitely feel free to check those out.
So Aislinn, I'm sure she'll be there. She tells me about the convexity of onions. Actually, onions, probably onions too as well. But how an oven works and how to use it properly. Aditi, you've been doing this for a long time. Stephanie's going to join us. Dr. Gangoul is usually there, and we have an argument about what's right. And Ernie's there cooking away. Chad sometimes shows up as well. I see that sometimes Stuart's there too as well. And my wife always hates those Sundays because I make a mess of the house and I take over the kitchen for a couple hours. So I keep forgetting, Aditi, is it going to be the first or second Sunday of every month? Is that our plan, depending if there's no holidays? So
we're going to do the first Sunday of every month, unless there's like a holiday, then we might push it to the second Sunday.
We're going to try to do that between 4 and 6 o'clock. So come have dinner together. Whole family's invited. If you're interested, let us know. In fact, we're having one this Sunday. And if you want to come join us, just either call the clinic on Saturday. We'll be in the clinic this Saturday. And send us to drkearnew232gmail.com. We'll put you on the list. And if you send us your email, you're all invited. And of course, samples are always encouraged to bring to the clinic of healthy cooking and things of that nature. Unhealthy cooking, give them to your next door neighbor that you don't like. But it's great. It's so much fun and so much discussion. I've actually even joined the UK British vegetarian group. We meet Sunday mornings at 5 a.m. Because that's British time, so you have to get to the Canadian times and stuff like that. Great discussion, great journal club with them, and they have some great resources. There's a Canada plant-based eating group too as well. So much to learn from, and these videos that are on there, they're fantastic. You want to become a healthy cook, we'll show you 10 different ways of doing it, and you can be oil-free.
Yeah, exactly. And I guess another great resource is Dr. Kearney's book, The 30 Days to a Healthier You, which we have on the next slide. So again, feel free to check those out. These are just resources that can be really beneficial for you to just check out. And obviously, you don't have to like read them all at once or listen to all of these webinars at once. Just a few at a time, or even watch the first half and then make sure you watch the second half. So later at a different date. But they're here for you, and we're never going to take them down. So you have all the time in the world. And then now, some exciting news. We have something coming, and it's not winter, it's the Kernew app. So we have a great team this summer actually working on the Dr. Kernew's cardiology app, and we have a lot of great ideas that we're putting in, but we're going to hope that it's all feasible and we can make it as good as possible. So we're thinking of having appointment reminders, medication lists, and information, clinic resources, and stuff like that. So you can see here, this is just a sample of what we're going to have. Obviously, this is an artist rendering, so it may not look exactly like this in the future. But we're very optimistic, and we have a great, hardworking team, and obviously would love your input. Yeah, looking forward to that.
Okay, perfect. And so the last thing that we'll be really talking about today is congestive heart failure management and prevention. So the first thing I want everyone to look at are the risk factors. And you can see 5 big risk factors here, and there are some smaller ones definitely. These are the ones that we really want to focus on right now. And so we can see high blood pressure, coronary artery disease, tobacco use / smoking, obesity, and diabetes. And with all of these things in mind, we can see that these are things that are going to lead to a greater proportion of individuals getting congestive heart failure. And Matthew had a very wonderful graph up before, and that kind of really very much ties in with these risk factors. And the whole goal of prevention really is to try to limit these risk factors. And what I want to really do for a bit here is just talk about how what effects getting rid of these risk factors can actually have for us. And so on the next slide, we can see that by controlling high blood pressure, you can actually reduce heart failure events by 48%. And so the study that specifically did this was the Systolic Hypertension in Elderly Program trial. And they looked at close to 5,000 people over the age of 60 and demonstrated that by reducing blood pressure from 170 over 77 systolic to 143 over 78, reduced heart failure events by 48%. And the one amazing thing about this is that they were able to get such a great effect by reducing something from a very dangerous level to a slightly dangerous level of 143 over 78. And if you remember earlier, we talked about what a normal healthy level should be like, and that would be something near the 120s over 80s or 110 over 70. And so there's still so much work that can be done, and by doing this, we can really, really reduce that the risk of developing the risk of developing heart failure. And then by reducing our tobacco use or controlling our tobacco use, there's a very, very big benefit. The risk of heart attack and stroke is reduced by 50% within the first year of quitting. That's just 1 year, and by that 3-year mark, it's almost as low as someone who has never smoked in their life. And so you can see how much of a profound impact that can have on you, just by quitting. And if that is something that does appeal to you, please reach out to us. We do have an amazing smoking cessation team here, and we can definitely work with you. We also have controlling obesity, and I think this is something else that you can make a very big, profound impact on. And Matthew talked a little bit about the BMI scale earlier, and you can really reduce your risk of heart failure events by 5% for male and 7% for females for every 1 increment of BMI that you reduce. So let's say you go from a BMI of 28 to 27, then that's 5% less, and then you can keep on going, and you can get that cumulative effect. And here is perhaps the most interesting one. We have controlling diabetes, and controlling diabetes. So what they found is this was a pretty big study called the Framingham Heart Study, and they suggest that diabetes mellitus, so type 2 diabetes, can independently increase the risk of heart failure by 2-fold in men and by 5-fold in women. And that is a huge amount of that's a huge impact, 200 to 500%. And so, we have a wonderful sugar club at the clinic. We have a wonderful weight loss club. Take advantage of all of these clubs and take advantage of all of these resources in the clinic and really work on this, because you can see that the effects are just amazing. And then here, with regards to heart failure management itself, we have 3 different zones that we kind of talked about. So the green zone, or the safe zone, is the zone where you're all you're all clear. So here we have really no symptoms. So you don't have any shortness of breath, no chest pain or discomfort, no swelling near your ankles, and no weight gain of 4 pounds in 2 days, or 5 pounds in a week. And you might be a little interested about the swelling in your feet, and that's really one way we can indicate if there's extra kind of fluid buildup down there, which is very much seen in congestive heart failure. And then if we move on to the yellow zone, you can see that this is kind of like a warning zone where you've gained either more than 4 pounds in 2 days or 5 pounds in a week. You've been having vomiting or diarrhea issues that have lasted more than 2 days. Some more shortness of breath than usual, and then you can see a whole list of other symptoms there. And again, you see that swelling, which is very indicative of CHF, and then a lot more breathing-related symptoms. And then in our red zone, we have a lot more. This is really an emergency where you need to call 911 and go see a doctor, where you're really struggling to breathe. The shortness of breath doesn't go away. Very fast heart rate, heartbeat, chest pain, confusion, or fainting. And so these are all dangerous things that you should definitely then go to the hospital for. So that concludes this portion of the webinar today. If we look at the next slide, we just have a little reminder for you to fill out that Google form. Again, you can either print it out and send it to us, or you can just fill it out online, and Stuart's going to be putting that hyperlink in the description of this YouTube video itself. You can easily access it.
Yes, thank you, Nurme, and for the whole team, and for everyone who stuck around throughout the whole presentation. We had a great mix of content today. So we had good information about health and lifestyle changes, why it's important. We did a live exercise together, so if you could do that, then you can do it every day. Or rewatch this webinar and repeat that section. You can fast forward and do it again with us. Once it goes up on the YouTube channel, it's recorded, so feel free to do that exercise as often as you want. And there is a nice summary sheet that's been put together for you, just to, I know it can sometimes get a bit long and a lot of information is put out there, so you can go in here and just look at the key points to see what you can take away from this webinar. And Dr. Kernew, I'll throw it over to you with any last thoughts, and then we have our closing quotes.
We're trying to do things in less than an hour, but you can see we failed miserably. in one sense, but I think we did a really good job of trying to go through the spectrum. Is that unfortunately, in my practice, the leading cause of deaths will be and is congestive heart failure. I'll repeat that. I believe the leading cause of deaths for most of my patients will be congestive heart failure. It starts early, so getting out there and learning good habits from eating to exercise are so important. We really didn't talk about much in the way of drug therapy today, which are life-saving medications. What we're trying to emphasize is that to use less drugs, you need to do a better job of looking after yourself. And it's not easy, but you know what? It can be a fun journey. And so the bare essentials looks like is a good pair of walking shoes, a good non-stick frying pan, an open attitude to try something different, blood pressure machine, and a scale. I love technology. I love the cardiac device. I love different body compositions. But really, the basics are the basics. And again, is that we're all going to get older, but I want to be healthier. What we learned is the last 2 years of one person's life is usually in misery, suffering. I wish when my time comes on my 100th birthday, as I 2 hours behind schedule, I finished my last patient and I dropped dead and had a successful career and family life, and my family's by my side. Reality is that most of us aren't dying that way anymore. We're dying slowly. We have no energy. Our brains aren't working properly. We can't walk. Our legs are swollen. The kidneys don't work. Can't see. Can't pee properly. And we blame the medication for everything. The blame is that we need to be as active as we possibly can. Our bodies will wear out. But you know what? We can make them work so much better. We give our car better maintenance than our body most of the time. So I hope this convinces you there's so much to do, and you're not alone. I can't do it by myself. I can't download a Google Doc properly, I guess, but I think I learned how to do that today. I learned a lot of things. And I want to thank all of you. You are young superstars. You're going to take over. And I thank you. And I thank you for taking the time to share what you learned and learning new skills all the time. If you can do it, old people like me can do that as well. So thank you for teaching us. Be healthier and make some steps in that right direction. Stuart, are there any other questions or comments that you see there?
No questions at the moment, so take it away with the quote.
Go ahead there, Marika.
Yeah, so Dr. Kearney shared this quote with me, and I loved it so much, so I wanted to start and end with it. Knowing is not enough, we must apply. Willing is not enough, we must do. So now we've gained so much knowledge, and we did a little bit of it too when we were exercising, and now it's time to keep it up and be consistent about it.
And we'll have our ups and downs in this, so. And so I think I want to thank everybody. Stuart, you get the last word.
Oh, yeah. I forgot we do that. Well, I always like to start off with thanking the team. So we had a lot of senior volunteers who really took it away for the past 2 hours. Did an incredible job talking about everything other than medications, talking about diet and exercise. And I think that I couldn't say anything better than what's already been said. But just to reiterate the quote, I think it's important to focus on not just listening to what we had to say, but trying to apply it. So I thought the live exercise that we did was a great example of trying to apply the things that we discuss. Trying to get up on our feet, trying to get moving, trying to think about the ways that we can be a healthier person, take care of our heart, take care of also our mental and physical health in all capacities. And we're just looking forward to trying to continue to cipher down our webinars to keep them close to an hour when possible, but we won't always make that promise. But we're just excited now. We got the summer schedule up and ready to go, and we're excited to deliver a new topic every Friday from here on out. So just excited about the direction of the clinic, and it was nice to see so many new people on our YouTube today. We had about 25 people on at certain points, so it was nice to see some new faces, and we would love to see you stick around for future webinars as well. I guess I'll pass it back to Dr. Kearney with some closing remarks, and then we'll sign off.
It's getting to be summertime. Get out, be active outside as much as you can. Learn new skills such as gardening. Learn, walk more. Be safe, and we'll see you soon.